What is pain? Two types of pain. Pain is a complex and universal experience that differs from individual to individual. The International Association for the Study of Pain, IASP, defines pain as an unpleasant sensory and emotional experience arising from actual or potential tissue damage. 1. In clinical settings, it refers to what the patient says or experiences. The experience of pain depends upon the biological, e.g. extent of illness or injury, psychological, e.g. anxiety, depression, fear, guilt, and social, e.g. support, criticism or withdrawal, factors, and thus requires its management accordingly. Pain management is achieved with therapy, usually with physiotherapy or chiropractic care. In fact, it can be considered a good thing, as it warns us that something is going wrong. It is the ultimate early warning system. Thus, it plays a powerfully protective role and, in some conditions, it is essential to save lives as it causes the individual to seek for help. No doubt, without pain the world would have been a dangerous place. There are two types we can experience, acute or chronic. 1. Acute or inflammatory pain. It can last for hours, days, or sometimes weeks is referred to as acute. Most acute pain resolves itself within 7 to 10 days. It usually warns the patient about tissue damage, inflammation, an initial disease process, or a surgical procedure. It has been reported that acute pain is not being addressed adequately due to poor pain assessment and the lack of information. 2. Chronic or neuropathic pain. It can last for months, years, and even for an entire lifetime is referred to as chronic. Chronic neuropathic worsens with time and accompanies many common diseases, including arthritis, diabetes, AIDS, and fibromyalgia. It may also accompany unhealed lesions or injuries of the body. Chronic neuropathic is a result of functional alterations of the autonomic nervous system. Chronic neuropathic requires physical input, such as microcurrent or acupuncture, in order to alter or change the nervous system into regulation. The state of pain management in modern medicine. The fact that pain is so subjective makes it difficult to measure and difficult to teach. It is a well-known fact that the subject of pain management is not instructed in medical or therapy schools, further complicating and confusing the patient who cannot receive proper diagnosis or treatments because the professionals are unqualified and possess the wrong tools and skills. Therefore, in order to cope with biological, psychological, and social pain factors, it requires a huge multidisciplinary team approach including government agencies, healthcare providers, non-government organizations, NGOs, educators, professional bodies, pain advocacy groups, and support groups to manage. Pain relief. Pain relief can be achieved through different methods. As we all know, some drugs can reduce pain. Should we always depend on pharmaceutical drugs? No, we should not for many reasons. There are alternatives methods which I'm going to list them now. Massage therapy, physiotherapy, chiropractic, acupuncture, TENS unit, shockwave therapy, herbal medicine. Depending on the severity of the injury or the illness, pain relief can be reached with manual therapy. Hence why physio, chiro, or massage is listed above.